excellence. That's the theme for today's edition of Jamaica Magazine, the local TV show that provides you with the information you need to make meaningful decisions about your life. For your health, we'll tell you about National Centers of Excellence designed to improve the quality of care provided for you and your family. The Health Minister is also here to give us an update on the work being done to ensure you have access to medication you need. We'll also give you a taste of the excellent entries into this year's festival song competition. I'm Adrian Atkinson, your host, so sit back, relax, and do enjoy.
Join the fight. Quit smoking for life.
Government is working hard to ensure you get the medication you need when you use public health services. Health Minister Dr. Fenton Ferguson is with us this week to talk about this important issue and other plans for the health sector.
Thanks for joining us for Issues and Answers. I'm Ian Boyne, the Minister of Health. The Honourable Fenton Ferguson is back with us. There are so many things to talk about in health and so many things that are taking place in health that we had to have the Minister back. We thank you for your company. Minister, thanks for your time. Again, last week we spoke about the infrastructural improvements, the thrust toward primary health care. A big issue a big issue of concern, Minister, is the matter of the availability of drugs. You know, people go to the hospital, even when you get through after the long wait, the drugs are not available. It's frustrating. Yeah. Any hope?
Well, you remember last week we spoke about the budget being increased by 4 billion.
4 billion, yes.
And part and parcel of that is really to respond in that way. The National Health Fund is also playing a greater role in relation to our pharmaceuticals. They have already taken over the Bustamante Children's Hospital, Port Maria Hospital, Percy Jr. in terms of the pharmaceutical area. And they're now moving towards the big one, which is KPH. Mm-hmm. And we believe that that too will make a big difference in the systems they bring to the table in terms of technology, inventory management, etc. Okay. And so while I still
you're going to reach KPH this year?
Yes, it is our intention during this financial year to get to KPH. And thereafter Cornwall Regional, which is also the big one, Mandeville, etc. We know and we understand. I think part of what we have to do to is better inventory management. Yes. We have to be able to know when your stocks are low. And I've had recently some discussions, my permanent secretary, Dr. Harvey, myself, with the NHF and other critical players, the chairman of boards, to say, you know, we have to keep our eyes. And this is all part of that misery index that I'm talking about. How do we really manage that those things which are recurrent discussions out there. I want you to understand also, Ian, that we would have been impacted by the devaluation over time, because even almost all the pharmaceuticals are imported. And while we are buying more, or at least
buying less, you're spending more, but getting less
in some area. And this is why that 4 billion will make a difference. Very soon you'll see me witnessing the signing of contracts for significant amount of funding for pharmaceuticals.
Pharmaceutical?
Yes.
So there's hope.
Oh yes.
There's hope this year things will be better.
There is hope.
In terms of supply.
You know,
yes.
yeah, and it is just so unfair. You know, when I look back over the last 3 years at what we have done
Yes. Tell us about
in the sector, we have been able to, after many years, Jamaica ratified, we were signatory to the Framework Convention on Tobacco Control. By 2005, we ratified it. But nothing happened. And we were able in 2013, after a year, to bring tobacco regulations, which is now seeing less admissions in terms of persons with respiratory diseases, the
having an
asthmatics.
impact.
Yes, it is
Already?
having a tremendous impact. And we expect within another couple of years, less heart attack, less stroke, because our public space is so much cleaner, in spite of some of the other environmental things that are impacted.
I'm happy for it.
We can say that that piece of legislation is possibly one of the most far-reaching.
Absolutely.
And we believe that as we continue to pursue a comprehensive bill, which will take into account tobacco advertising, promotion and sponsorship, taking into account the illicit trade, looking at Article, the TAPS is Article 13, Article 15, which speaks to illicit trade, Article 5.3, which speaks to the relationship between public officials and the tobacco industry.
Yes.
That is important in relation to conflict of interest. And we continue to pursue Article 6, which we are happy that this year the Ministry of Finance, we got an additional $500 million in revenue from the industry. But we believe that what we are pursuing, it is just. 70% of the lung cancer cases at the National Chest Hospital, tobacco related. 90% of all these lung cancer cases, chronic smokers. The evidence is overwhelming. Outside of the international data, we are saying on the ground. I remember 1 week after the...
Let me take the break. And before I take your anecdote, Minister of Health, explaining his policies, giving hope that things are going to be better in the health system this year. We take a break, but we'll be right back.
Mr. God, you know I didn't want to ask you this question a long time. Do you have a JADET card? You know, if you have a JADET card, it can save you lots of money when you go to the pharmacy.
Man, certainly, man. I have my own JADET card, man. I've had it for quite some time now. That's helped me tremendously with my health condition.
That's nice.
Senior citizens on the Jamaica Drug for the Elderly program. Take your card to participating government or private pharmacies that display the JADEP sign. Then collect your monthly supply of approved drugs for the chronic illnesses covered by the program. To know more, call the toll-free number 1-888-GO-JADEP. That's 1-888-465-2337.
We're with the Minister of Health, the Honorable Fenton Ferguson. Yes, you're about to give us an example.
Yeah, I remember 1 week after the promulgation, I went to the West Corner region and a security guard called me, said, Minister, I'm really glad that you come with this banning of smoke. Because I'd just coming from a colleague of mine, funeral last Sunday. She never smoked a day in her life. Her husband smoked. She's the one who was buried. And there are numerous examples of this, where the passive smoker becomes the victim. And what is worse in these instances is that you would have had a spouse, surviving spouse, who would be there moaning and crying and all, and saying how much he loved his wife.
But his actions,
but he loved her to death, you know. So in a real way, I believe that what we have to do
So this
now,
legislation has literally saved lives, Minister.
save life, and there's no doubt about it. And the industry has never taken on the facts.
No, the
and
scientific
the evidence.
facts
Scientific
are well established.
Well established.
Unquestionable,
globally.
yes.
Jamaica is being called on to go to other places. I was the only speaker. I just came back from Geneva, the Commonwealth Health Ministers Conference.
Yes.
Jamaica, I was the only speaker at the luncheon speaking about they wanted to know about tobacco control. I've had invitation to India. We have regained the international respect right across the globe now. If you go to PAO, if you go to WHO,
Yes.
Jamaica, and the team, because it's a team approach, it's not about me. It's a team that has been working effectively over time, and we are getting the recognition now. And I believe that what we are doing with primary care, what we are doing in terms of, they're talking about ambulances, we brought in 19 ambulances, the first set of ambulance since 2007. And we are bringing in another 16 during this financial year. Okay. When we look at all of what we are doing, we are implementing a program known as PROMAC, which is speaking to child and maternal health. This is a grand program, and we want to congratulate and thank the European Union. 22 million euros. And you know the euros are strong.
Yes.
So that's over 3 billion Jamaican dollars over the next 4 to 5 years. Building infrastructure, we're going to be doing 6 brand new identity unit, which will be for newborns. And we're going to be doing 5 for, maternal. All of this will improve chances of survival of mothers and survival of newborn. This is critical to us. But outside of that, they're going to be doing other kinds of infrastructural work. We're going to be training over 1,000 health workers. And we have started now additional community health aides. Big project. All of this is happening during this period. So, when I look at the situation, Ian, it is unfair to want to define my leadership as minister on the basis of chickpea.
Yes.
I am of the view that while we had challenges there, what we have done internationally, in terms of our friends that we have established and our good name been rebuilt in these quarters, what we have done in terms of policy related to the risk factors involved in the non-communicable diseases, which is the diabetes, the high blood pressure, the cancers, the sickle cell. 70% of Jamaicans are dying every year from the NCDs. 70%. The non-communicable. 70%. And therefore, what we are focusing on now is the risk factors, the tobacco, abuse of alcohol, unhealthy food or diet, physical inactivity. Those are the areas, and we have developed policies around in terms of food, the guidelines for all of that.
They're wrapping me up. But you will ensure that with the Zika threat, you're going to deal with that in a way that the public will think it was more effective than how you dealt with
Well,
chickpea.
people are now saying the minister is premature, is moving too quickly. We got the epidemiological alert on the 7th of May. By the 20th of May, we had a national committee in place, and we're meeting every week. Every week they're meeting. We are identifying funding. The advisories are out. You would have seen the advertisement running. And
you're on the ball with this one.
This one we are out there running. And I just want to say in relation to the Zika virus that it has been around since 1948. So it's not a new. The threat is new for the region. And there are still Since that time, there have not been many outbreaks. In fact, I think there are about 6 or so outbreaks.
I see.
So there is sketchy information, but there's been no deaths related to the Zika.
You're still not taking
virus.
any chances.
But we're
You're
not taking
it lightly.
any chances.
You're meeting every
it
week.
has similar kind of thing, the arthritis
Yes.
and the rashes and the headaches and, similar to chickpea.
Yes.
But the evidence thus far relative to the impact, no doubt we want to warn our children, our elderly, persons with chronic diseases, the same NCDs we talk about. We have to take special precaution. And my final appeal is asking of the citizens of Jamaica, personal responsibility, cleaning up around your home, places of worship, schools, etc. Very important.
Thank you very much, Minister. Quite a bit of information over the past 2 weeks. The Minister presenting his report card, and I'm sure you will agree that much has been accomplished. Next week I'll be back. Until then, Ian Boyne wishing you a very pleasant day.
Jamaicans all across the country have been getting the best quality health care in centers of excellence. These health centers offer critical care, oftentimes dealing with patients right there, so they don't have to visit a hospital. Learn more about these centers of excellence in this next feature.
4 primary healthcare centers of excellence developed to tackle the rise in non-communicable diseases and to improve healthcare services across Jamaica, from Claremont St. Anne in the north, Santa Cruz St. Elizabeth in the south, St. Thomas's Isaac Barant in the east, and Darlaston Westmoreland in the west, one in each regional health authority. They were developed to offer more comprehensive and holistic services at the primary level. It is clear healthcare in Jamaica is pointing in the right direction. The Isaac Barant Center is unrecognizable to the structure first built in 1966. Now, diabetes and hypertension are among the most common diseases affecting these residents, and this improved facility allows for easy access and convenience in health services. Oral health, among many other health services, is given pride of place at the Isaac Barant Center.
And one of the things for this first phase of the refurbishing was actually refurbishing of dental. And with that, we've increased the number of operatories, which are the stations at which we treat patients.
Thanks to these facilities, healthcare is no longer 45 minutes away to the Princess Margaret Hospital, which is the nearest health facility.
The hospitality here now is great, let me tell you. And some of the bigger hospitals, and when you go there, you have to wait, all 4 or 5 hours, 6 hours to get attention. But when you come here, you get your attention straight away.
The whole people of this community, which incidentally is over 30,000 people, because we not only serve St. Thomas, but we serve Eastern Portland as well, as far away as East Prospect.
Welcome to the Santa Cruz Center of Excellence.
Only smiling faces here at the Santa Cruz Center for Excellence in St. Elizabeth. Due to the impact of a high level of service, quality healthcare, and the wonderful working environment for staff and users, customer service is at its highest.
It's a better place now than it was before. In terms of services, you have more things being offered. Patients are cared for more. You have more doctors available.
That we have more than what we had before, so we can work efficiently and effectively on a daily basis.
This Center of Excellence is ideally positioned to respond to the healthcare demands of several communities in the parish. Maternal and child health care is among the many services offered at the Darlaston Center of Excellence.
What we usually do, we usually go out in the community to look for our mommies. Now they come to us. They come to us and you notice they're willing to sit and stay, because it is much different and it is much improved and favorable for them. They don't have to go down to Savannah or to Montego Bay for all the service. They can always come here, and believe me, majority of the things we can offer right here.
Another major area of improvement is the ability to access patient data easily.
The EPAS system is actually the electronic patient administrative system where inpatient information is entered real time from the clinician's desk on a computer, and that information is stored and is accessible only to other clinicians who need the information so that they can adequately and holistically serve the clients based on the information that is there for the patient.
Last but by no means least is the Center of Excellence located in the Garden Parish of St. Anne in the community of Claremont, where chronic diseases such as diabetes are common among many residents. The pharmacy service is a major highlight. Patients can now see the doctor and immediately after fill their prescriptions under the same roof.
You can imagine if they had to come down and see the doctor and then fill a prescription somewhere else, it would cost them a whole lot if they had to go and buy it at the private pharmacy or if they had to go to either Monique or St. Ansby to fill it. So it's very convenient for them, and they have expressed that they are so happy to have this pharmacy here.
This is very good because when we have to get up to reach St. Ansby, it is very hard, and we have to pay $500 for our fee, and it is very costly. And sometimes when we go down there, we don't even get anything. We stay a whole day and have to go back the next day. So I think this is a very good thing that the minister has done for us.
These 4 centers of excellence, which operate like polyclinics, will help to address the problem of non-communicable diseases and improve health-seeking behavior to secure the future for a healthier and productive Jamaica.
The 2015 Emancipation celebrations are just around the corner. By the time you're quint, it's festival time again. The Culture Ministry announced a long list of activities that will rekindle the spirit of festival for both young and young at heart. Take a look at some of what's in store.
It is that time of year again when we gather to launch the activities for festival, and this time it's Festival 2015.
The content and context of the activities of this year will not only commemorate our historic achievements and the movement into emancipation and independence, but it will also spur a sense of belonging to the nation and its successes. The celebrations will be diverse, appealing and attractive to a wide cross-section of our society.
You are willing to make the sacrifice, somewhere to go and roll the dice, but that won't change
The National Church service will be on July 26 at the St. Jago de la Vega Cathedral at 10 a.m.
So is what will grow. Oh, yes.
From Friday, July 31 to Thursday, August 6, 2015, a series of events and activities will be staged across the island. All parishes will have their Emancipation Vigil on the night of Friday, July 31. On Saturday, August 1, we mark Jamaica Day with the opening of the Independence Village at the Ranny Williams Entertainment Center. This will feature Jamaican food and our creative and nutritious meals, beverages, treats, and health offerings. Lunch hour concerts, a literary and film festival, a chat room and picnic fest are all features of the Independence Village. Hope Road from King's House Gate to Phoenix Avenue will be transformed into a bright and vibrant marketplace with Saturday market. Parking will be provided for shoppers at King's House. We bring in curry uptown. Sunday, August 2 is being designated as Family Day. This year, and Jamaican families are being encouraged to come together and share quality time. On August 6, the Grand Gala will come alive of the country's biggest celebrations with over 35,000 patrons. The Grand Gala event this year will unite the country in one major celebration of our theme. As usual, we look forward to the selection of the festival song for this year.
1962 Jamaica born, them a wonder, oh we young and so blessed. So me say along Jamaica born, they haven't seen nothing yet. That's why me love my pretty little island, the place tourists come to east west. So welcome one, welcome all to me pretty little island of the greatest. Jamaica we little but we calabar.
Yes, me neighbors drink cut down your tent. How them expect me to go left down your
Give me baby sweet festival sound, and everybody come to town. Give me baby sweet festival sound, no nobody come take me down. The festival sound and the whole mental sound. Give me baby sweet festival sound.
When you see me ancestors, me might look white, yes, I'm still black. In the streets, them a ask if a yellow man that Jam rock full of star like that. Made in Jamaica by Jamaicans.
And our national festival queen.
Bless her, bless her.
The Jamaica Gospel Song Showcase and Finals are on August 2. Melody-Round and World Reggae Dance Championships on August 4 and 5. Public participation is also being sought through a wide range of initiatives that include window dressing competitions, working with JCC and the PSOJ, the Best Decorated Office Business Competition, the Media Competition of the Media House, which best demonstrates the spirit of independence, awards for the advertising agency that best utilize the independence theme, competitions among parish councils for the Best Decorated Town, for Independence and the KSAC. We also have design and sale of Independence Jamaica 53 memorabilia through private merchants, and the best diaspora celebrations and competitions via social media.
Remember when we did have things and we say a colorful flash with a floral dash?
We will see the return of festival fashion under the theme Bandana with Denim, create the fashion rhythm.
You see this piece of cloth? It is no longer a piece of cloth. It is now called fabric. Because it gone in a society, Miss Denim married to Miss Bandana, and things are going on.
Never forget my Jamaican shore. Let's open the door and welcome the poor. Show love to each other some more. I know we no nice like my Jamaica. No we no sweet like my Jamaica.
This is the right one. This is the original one. Over time, we lost touch with it, and sometimes we couldn't find it, and so some other designs came with a finer plaid. But if you're buying, try get this one. This is what really is or not.
The nation then Mrs. McCann have your pants they come, me bry out a barrel, go muggle, 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 muggle. Ladies and gentlemen, Miss Culture 20 Nuff Nuff.
Spend time in America and in Canada. No way to me like my Jamaica. No way no nice like my Jamaica. No way no sweet like my Jamaica. We spend time in America and in Canada. No way to me like my Jamaica. When me day a foreign hungry used to bust me shut. Now me there Jamaica, all of my things they food me gut. Like bread.
We're going to cook up a whole heap of fashion.
We have to give thanks to your land like this. No matter the
Rural celebrations will happen concurrently through all parishes. The structure of events within the parishes will include the Thanksgiving services, the Emancipation vigils, the sounds of drums, the festival bandwagon, the Independence Day flag raising ceremony, Independence Day stage shows, and street dances.
This is where we close the pages of the magazine. We hope you were informed and entertained. If you'd like to see it again, our website is a constant source of features and information. Our YouTube channel is also a great portal for videos. We value your feedback, so drop us a line at jamaicamagazine@gis.gov.jm. Thanks for your company. I'm Adrian Atkinson. Have yourselves a wonderful Sunday.
This has been a production of the Jamaica Information Service, the voice of Jamaica.